Next speaker is Dr. Manik Sardana, who will be speaking on early detection of glaucoma progression using OCT angiography and comparing it with visual field and RNFL on OCT. And the discussion for this presentation is Dr. L. Vijaya, ma'am.
Good evening, everyone. So the title of my thesis was Early Detection of Glaucoma Progression using Optical Coherence Tomography Angiography and comparing it with visual fields and RNFL analysis on OCT.
Sorry, that timer which went off meant what was 3 minutes?
3 minutes, but the paper was for 4 minutes.
So just mention that because we are not keeping time.
I'm keeping time.
4 minutes, there'll be a double timer or something, no?
Yeah.
I'm keeping it here. 3 minutes पे एक बजा देंगे, फिर 4 minutes.
Was it according to time, the previous
This
paper?
one was according. Sorry, we'll start again.
So the title of my thesis was Early Detection of Glaucoma Progression using Optical Coherence Tomography Angiography and comparing it with visual fields and RNFL analysis on OCT. So glaucoma progression can be computed via functional or structural testing. Functional testing is done with the help of visual fields. Structural testing is done with the help of OCT. And OCT angiography is a new upcoming modality for structural testing. So the objective of our study was to compute glaucoma progression on OCTA and compare it with visual fields and RNFL analysis on OCT. So OCTA is a non-invasive and objective assessment of optic disc vascularization. Vessel density, which is the main parameter in OCTA, is calculated as percentage of area covered by vessels over the total area, and many studies have correlated areas of vessel density decline with areas of nerve fiber layer on OCT. So ours was a prospective non-randomized study. We included 64 eyes of 38 patients. The inclusion criteria was age more than 18 years, and we included patients of early to moderate glaucoma. So at first visit, we had two reliable visual fields, 3 OCT scans of the nerve fiber layer of the disc, and 3 OCTA scans of the optic disc. Average was taken for reliability. Same set of scans were repeated in the next follow-up after 9 to 12 months. So how did we analyze progression? On visual fields, glaucoma progression analysis software was used. On OCT, more than 5% decline in the sectoral nerve fiber layer thickness was taken as progression. And on OCT angiography, both quantitative as well as qualitative was taken as progression. Quantitative when more than 5% vessel density decline, and qualitative assessment was done by 2 glaucoma experts, both were blinded. So this is just a representative image showing corresponding defects. We can see a superior nasal notch and corresponding defects on OCTA, OCT, and visual fields. Coming to the results, the mean age was 53.6 years. Follow-up duration, as already told. Mean vessel density was 37.4% in early glaucoma and 37% in moderate glaucoma. 8 eyes progressed in the early glaucoma group in OCTA and 15 eyes progressed on a moderate glaucoma group in OCT angiography. The mean vessel density decline on follow-up in OCTA progressor was minus 4.1. This is just a summary of progression. 14 eyes progressed on visual fields, 18 on OCT and 23 on OCT angiography. This is a Venn diagram showing all the eyes progressing on various methods. This is comparing progression on OCTA versus visual fields. So when visual field progression was present, most of the time OCTA progression was also present, and when it was absent, OCTA progression was also absent. So both methods agreed statistically, and similarly OCTA and OCT also agreed statistically while comparing. So to conclude, our data suggests that OCTA correlates well with the visual fields and appear to pick up progression earlier than OCT. So OCTA offers to be a potential tool for early detection of glaucoma progression in the future. Thank you.
Yeah, good presentation. You said OCTA was assessed by 2 glaucoma specialists.
Yes.
What was the agreement between them?
And both were blinded, so agreement, they both agreed, yes.
Yeah, did you check for that?
No, ma'am.
Yeah. Okay.
So both of them were completely blinded, yes.
Okay.
So both quantitative as well as qualitative assessment was done in us.
Yeah, because the reason I asked, because it is evolving technology, it is still has to get refined.
Yes.
To use it like a OCT GPA or visual field GPA. So I'm just curious to know how the 2 glaucoma specialists fared when they were looking at the It's not easy
Yes, yes, ma'am.
to exactly comment the same way between the two people.